This is Pastor Pava, and I want to welcome you all in this podcast where we are going to discuss more about stroke. So, I have joined by a health worker specialist who will give us more insight about stroke. So, I welcome you in this podcast.
You're welcome.
And I beg you to introduce yourself.
My name is Lascias Jairus.
Okay. So let's talk about stroke.
Yeah. If you can say about the stroke, stroke is the disruption of blood flows to part of your body brains. Yes, this is the stroke.
Okay.
Yes, symptoms can also come on quickly and without warning. If a stroke attacks your body, it doesn't give you the quickly signs.
Yeah.
Recognizing the stroke symptoms and seeking treatment quickly can also lead to better outcome. So stroke occurs when the blood vessels in the brain recapture and bleeds, or when there are blockage in the blood supply to the brain. Recapture of blockage prevent blood and oxygen from reaching the blood tissues. That's why the stroke occurs.
Okay, so what are the symptoms of a stroke?
Symptoms of stroke. There are so many symptoms of stroke. Start with the loss of blood flow to the brain, damage the tissue within the brain. Symptoms of stroke show up body parts controlled by the damaged area of the brain. So the sooner person having stroke get cares, the better the outcome is likely to be. For this reason, it helps to know the sign of stroke, so you can act quickly. So let's tell you the symptoms of of stroke. The first symptoms is paralysis. The second symptoms is numbness or weakness in the arm, a face, on the leg, specific on one side of the body, or any other way I can say hemiparalysis.
Yes.
The third one is trouble speaking or understanding others. Another is slurred speech. Another is confusion or demonstration or lack of responsivity. Yes. Another is a sudden behavior change or especially increased agitation.
Okay, is the stroke requires immediate medical attention?
Before I answer that question, just go back to symptoms of stroke. There are so many symptoms. Yeah, I just want to proceed by that question.
Okay.
Dizziness, lack of balance, trouble walking, seizure, nausea or vomiting. This is the symptoms of of stroke. So you ask about the stroke require immediate medical attention. I can answer that. Recognize the symptom of stroke in someone can play the important roles in improving their outcome.
Yes.
Recommend you be the first. The first one is balance. By the way, balance it means they are having trouble with balancing or coordination. Yes. The second is the eyes. They are experiencing visual symptoms like double vision or blurred vision.
Yeah.
The Fade is a face. Does a one side of their face dropped if they try to smile? The fourth one is arm. Can they lift both arms, or is one arm weak or numbers?
Yes.
Fifth one is speech. Is their speech slurred or difficult to understand? The sixth one is time. If one of the above symptoms are present, time to call the word 911 or your local emergency service.
Yeah.
So according to the question you asked, I think I'm well answered.
Okay, so what causes a stroke?
The causes of stroke. The causes of stroke depend on type of stroke. It means there are some type of stroke.
Okay.
But the type of stroke, they are depending. Stroke falls in these main categories.
Yeah.
The first category is ischemic stroke. The second is hemorrhagic stroke. The third one is transient ischemic attack. This is the causes of what? Stroke. I have heard that stroke it attack depending on type of what? Stroke. Yes, you can proceed with a question.
Okay, so what are the types of stroke that affect my treatment and recovery processes?
Type of stroke which have affected the wider treatment and recovering process. The one is ischemic stroke. I think I have already that stroke it categorized according to type of stroke.
Yeah.
I think this is the one which I already mentioned about the type of stroke that is ischemic stroke. So only ischemic stroke is during an ischemic stroke, the arteries supplies the blood to the brain narrows or the what become blocked. Blood clot or what severe reduced blood flows to the what to the brain causes the blockaging. Piece of plug breaking off and blocking the blood vessel can also cause that the Islamic stroke. They are also on same point on ischemic stroke. There are also two types of blockage which can lead to ischemic stroke.
Okay.
The first one is cerebral embolism. Occurs when the blood clot form another part of what? Body. Often the heart or artery in the upper chest or neck, and they move through the what? Bloodstream until it hits an artery to what? To narrow to let it pass.
Yes.
So the clot get stuck or stop the flow of the what? Of the blood and cause the stroke. And the first type of is ischemic stroke is cerebral thrombosis.
Yes.
Carpena athrotic stroke, which occurs when the blood clot develop at the fat parenchyma within the what? Within the blood vessels. So I back to type of stroke which have affected and treatment and recovering process. Is second one is hemorrhagic stroke. Hemorrhagic stroke, there's so many things I can explain about the hemorrhagic stroke. Hemorrhagic stroke it just happens when the artery in the brain break open or leak. The blood flow that artery create excess pressure in the skull and swell the brain, the damaging blood cell or the tissues. Doctor categorize the hemorrhagic stroke into the two primary types. Also the hemorrhagic stroke, they developed into the two according to the doctor. The first one, the doctor categorize into the what? Intracerebral hemorrhagic stroke, which is common type of what? Hemorrhagic stroke. It just happens when the tissue surrounding the brain fills with a blood after an artery burst. Artery burst. The second type of hemorrhagic stroke is a subarachnoid hemorrhagic stroke, which is pronounced as SAH, which is common. It just causes bleeding in the area between the brain and the tissue that cover it. I want to proceed with a type of stroke that affects the treatment and recovering process. Transit ischemic attack. Many stroke occurs when the blood flows to the brain is blocked temporarily. Symptoms are also similar those to full stroke. Sometimes typically disappear after the few minutes or hour when the blockage move and the blood flows is stored. Blood clot using the cause while it is not a technical full stroke. According to the American Stroke Association, close 1 to 5 people within the TA will have full stroke within the 3 months. And so in the America they have experiment for the 1 to 5 people, but they found that in a 3 months most people they found with a problem of stroke. I think I have heard about that question.
Okay, so what are the risk factors for stroke?
There are so many. There are more risk factor for the stroke. Before I mention it, I'll later explain about it. Certain risk factor make more susceptible to stroke, including unbalanced diet, higher in salt, saturated and trans fat, and cholesterol, physical inactivity, heavy alcohol use, tobacco use, family history of stroke, high cholesterol, high blood pressure, diabetes, sickle cell disease, heart valve defect, parent ferment ovary, Ledmo. Explain about the Ledmo. Understanding and controlling risk factor for stroke. Carrying too much excess weight, heart disorder such as coronary artery disease. There are so many which I cannot finish today.
Okay.
Yes.
So let's move forward.
Yes.
What are the complications of a stroke?
Complication for stroke. I can say there are also some complications with stroke. The complication after a stroke can vary depending on the parts of brain that are experiencing severe damage. So the doctor can complicate about the stroke according to the where the stroke attack the people. So there are so many stroke. The part of the brain have experiencing severe damage. So some of that application include, the first one is seizure, the second one is loss of blood and bowel control, the third one is problem with speech and swallowing, the fourth one is cognitive impairment including dementia. There are so many other are sensor or sensation change. Other are shoulder pains, bed sores, depression, mood, information or behavior change, reduce mobility, range of emotion or ability to control certain muscles, movement. There are so many.
Okay.
While you may be able to overcome several complications after time, sir, may be permanent. This is how I can answer that question.
Okay, so how to prevent a stroke?
The way we can use to prevent the stroke, there are 4 ways we can use to preventing stroke.
Yeah.
The first way, quick smoking. Maybe you can ask how the quick smoking help to prevent the what? Stroke.
Yeah.
If you smoke quicking, now you lower your risk of stroke. You can reach out to doctor to create a quick plan. That is first. Second one is limit alcohol use. The people must drink alcohol in a limit. Yeah, heavy alcohol consumption can raise your body pressure, which can increase the what? Risk of stroke. If reducing your intake is difficult, they contact the doctor for help. Okay. If you think that you cannot stop drinking alcohol, just to consult the doctor. Maybe can tell you the way you can use to suffer. Maybe they can use the way you can continue to use your life through drinking the alcohol. The third way is keep moderate weight. You need to keep the what? Moderate weight. Overweight and obesity increase the risk of stroke. To help manage your weight, eat a balanced diet and stay physical activity. Both step also reduce blood pressure and cholesterol vessels. Lastly, on the prevent of stroke is get regular checkup. So the person who undergoes stroke must go to hospital so that the hospital can treat them well. So talk with a doctor about how often you get checkup for blood pressure, cholesterol, and condition you may have. They also support the making this lifestyle change and offer what? The guidance.
Okay.
Yes.
So how do doctors diagnose stroke?
The doctor can know the stroke through the many ways. To diagnose the stroke, the doctor will first ask you or family member about your symptoms and what you were doing when they are lost. They will also take your medical history to find out your stroke.
So they can ask you about your past.
That's why most people, when someone suffer from any disease, when go to hospital, they force them to have that book which keeps the history of what you seek previous year or previous day. So also here, so the doctor will consider you to see the what history, which disease you seek after before you go to hospital for stroke. Yes.
All right.
The risk factor. So the risk factor which the doctor can take in order to know how they can diagnose you. These are also ask what medication you take. The first question they ask you, you take any medication
before you visit the hospital?
Yes. You check your blood pressure. Listen to your heart. You also physical exam during which doctor will evaluate for you. Maybe the doctor can evaluate 1 for balance, 2 for coordination, 3 for weakness, 4 for numbness in your arm, face, or legs, a sign of confusion, vision issue. Doctor can attest to you many things so that they can know that this disease is strong. So a doctor will then also do the what? Imaging or blood test to help confirm stroke diagnosis. This test can help them determine whether you had stroke or not. If it is so, what may have caused it? What part of brain is affected? Whether you have bleeding in a blood? Yes. So this is how the doctor can diagnose you in order to know if you seek stroke.
Okay, so what is the treatment for stroke?
The treatment of stroke, I can say that a proper medical evaluation and a prompt treatment are vital to recovering from what? Stroke.
Yeah.
So a treatment will depend on type of stroke.
You are suffering.
Yeah.
Mm.
It means there are so types of what? Stroke. Also the treatment may come depending on what? On the stroke or you suffering. For example, the ischemic stroke. Since the blood clot or blockage in the brain cause these stroke types.
Yes.
Doctor essentially treat the what? Them with similar techniques. They can include, the first one is thrombotic drugs, namely tissue plasminogens activator. This thing, it help you to break up blood clot in your brain.
Yeah.
Because this disease it affects the person in one part. So these thrombotic drugs, if a doctor give you, it help to affect the what? It help to break the blood clot.
Yeah.
Maybe somewhere in your heart or in your brain there is blood clot. So this, if the doctor give this drug, it go straight that part to break the what? Blood clot. As thus you can feel better.
Okay.
The second one is a mechanical thrombostomy to remove the what? Blood clot within 24 hours of symptom onset. This is the first drug which the doctor give you at least for 24 hours.
Yeah.
You be cured.
Okay.
The third one is stent to support the weakened artery walls. Stent is just to help you to what? To make the artery to be the strong.
Yeah.
Yes. First one is a surgery to remove the plug from the what? Artery.
Yeah.
If you suffer from stroke, if the condition is worse, the doctor can use the word surgery to remove the word artery to see what makes you to suffer that stroke. The fourth one is aspirin or other bloody thickers to prevent the what? Further blood clot. Another prevention is hemorrhagic stroke. Hemorrhagic stroke is one type of stroke, but this way I just want to tell you how we can prevent the hemorrhagic stroke.
Yes.
Yeah, stroke caused by bleeds or leak in the brain require different treatment strategies. Now, treatment for hemorrhagic stroke include, this is where how we can treat the what? Hemorrhagic stroke.
Yeah.
The first way is medication to reduce the what? Blood pressure. Also the prevent seizure and prevent blood vessels constriction.
Yeah.
The second one is surgery to repair the what? Brain, usually by processing, coding or clipping. The second one is which some book just like addition to emergency treatment.
Yeah.
Your healthcare team will advise you on how you can prevent the what? Future stroke. Yes, so this is how I can explain about the treatment of stroke.
Okay, you have well explained about the treatment. So what are the medications for stroke?
If I can say about the medication, I can say a doctor uses various medication, both to treat stroke and prevent future stroke. The type of medication which a doctor prescribed is just depend largely on the type of stroke you had. So there are commonly stroke medication which a doctor can give you.
Yeah.
The first is TPA, which injects into blood vessel to break the what? Blood clot during the stroke.
Yeah.
This is the first medication. The second medication is anticoagulant like warfarin or Jatavens to prevent blood clot or stop existing clot.
Yeah.
Yes. From what? From getting large. The third one is direct acting oral anticoagulant, which newer drug classes of what anticoagulant that work faster and require less monitoring. The fourth one is the blood pressure medication. As a higher blood pressure in a leading is a leading risk factor that stroke. Yes. Finally, medication is statins to lower high blood cholesterol vessels and reduce plaque build up on the artery walls and could lead to a clot.
Yes.
This is how I can answer about the medication of stroke.
Okay, so my last question. What can I expect during recovery from a stroke?
The thing you can expect from recovering from stroke is a leading cause of disability in the United States. So while there are some people who will recover, many will have longer disabilities. Yes. So it's so important that recovering and rehabilitation from the stroke is as soon possible. Stroke recovery should begin in a hospital. So in a hospital, care team can stabilize your condition and access affected of stroke.
Yes.
They can identify underlying factor and begin their flaps to help you to regain some of affecting skill. So stroke recovery typically focus on 4 main areas. So let me tell you 4 areas which the stroke affect.
Yes.
So first area is speech therapy to learn how to speak and help with swallowing difficulties. 2, cognitive therapy to regain former patterns of thinking and behaving. 3rd one is physical therapy to regain strength and balance and adjust to any limitation. Other books just that if you suspect that you experiencing symptoms of stroke, it is good or vital to seek emergency medication treatment first, as soon as possible. Healthcare profession can also provide clot busting medication in the first few hours after the sign of stroke begin. So the doctor can give you early treatment most effectively way to reduce the risk of long-term complication and disabilities. And so there are many experiments you can recover from from the stroke. This is how I can answer that question.
Okay, so this is the end of our discussion for stroke. So have learned more about stroke, and the people who are listening, they can gain something from it, so that they can have a choice and how they can prevent from getting stroke.